Hi, I'm Betsy Masters. I'm coming to you today from the Community College of Philadelphia on behalf of the CCCAP for the 2025 lecture series for the Student Design Competition. And I have with us today Denise Thompson, who's our lecturer, Angela Motzi, who is one of the jurors and another lecturer, and John Dwyer, who is also a juror and our third lecturer. And Denise is also a juror, by the way. So this recording is for Denise's lecture, and she is principal at FCA in Philadelphia, where she is a member of the healthcare team. She leads FCA's sustainability efforts in healthcare, bringing extensive experience in green design to each project. Her passionate approach and commitment to environmentally responsible architecture have made her a key figure in the industry. She's actively involved in the AIA, and she now co-chairs the Academy of Architecture for Health Committee. Let me say that again, Academy of Architecture for Health Committee for AIA Philadelphia. She's active in local mentorship groups, bringing the profession to the next generation of architects. And I'm also, as an AIA Philadelphia member, proud to say Denise is the 2025 Thomas U. Walter Award recipient. So with that, I would like to turn it over to Denise for her lecture, Healing Spaces.
Okay, great, thank you. Let me share my screen. Can you see that? Okay. Can you see a screen? Oh, uh-oh. Sorry, can you see my screen? Is it reading okay? Okay, sorry, it does not look good on my screen, so I do apologize. I'm gonna do my best. So yes, if everyone can see, just help me real quick to say the top of the screen says Design Fundamentals. Okay, great, thank you. Then I will go from there. So at FCA, my goal today was to just run through a lot of our projects and examples and some of the processes that we go to when we think about how to create spaces that are for healing and wellness. In a healthcare environment, unfortunately, nobody wants to be there. Usually, no one wants to be at a hospital. So if you find yourself in that type of environment, our goal is to make your experience as positive as possible and thinking about your experience to be, again, as calm and serene and safe as possible. And while we do that, we're also thinking about your health and wellness in both, the mental and physical aspects of your health. And when we think about that, we think about things like sustainability and providing green materials and healthy indoor air. Because when we think about going into a hospital, a place that you're supposed to want to be healthy and get healthier, what seems very counterintuitive is to go into a building that could make you sick, right? So we want to create a space that is healthy for you to be in and hopefully come out healthier on the other side. So with that, we think about the patient experience throughout the process. And today, the way I wanted to present some of that is using the WELL building certification system. So there are many systems out there in the marketplace that you can use to help design your buildings and think about ways to promote health and well-being in your spaces. And the WELL system is one that is very person focused and patient focused. And so it goes beyond just the building, but how the person interacts with the building, how they can be healthier through the use of their building, and that is patients and staff. Some of the concepts around WELL really started in more of a corporate office business environment and really trying to think about employee health and well-being. And we at FCA, one of the many things we try to do when we design buildings is think about that holistically, not just in a business environment, but in all types of spaces. So we want to look at all the different aspects of health and well-being and bring that into any environment that we design. So at the top of the screen, we have the 10 kind of points of WELL version 2 that you could look up online if you wanted to learn more about that. And these are the aspects of the projects that I'm going to talk about today. One of the things we do when we're working with our clients is try to help them visualize the space that they're designing for themselves, their clients, their users, their patients, their staff, and we really need to help bring them on a journey to help them design the space that's going to work best for them. We're going to use all the tools at our disposal of hand sketching, computer generated models, physical materials, trying to really help a client understand the process that they're can feel comfortable that they're going to know what they're going to get. And when we do that, we think about encouraging them to create a narrative around their project that helps focus on wellness and well-being. So I have many project examples to go through, so I'm going to go through them somewhat quickly and just talk about some of the key highlights. This project here is a lobby expansion and master campus plan that we did for Newark Beth Israel, which is in Newark, New Jersey, a very urban environment. Previously, and you can kind of see through this picture, the buildings in the background are all brick and stone and very solid to their environment. This is a campus that has a neighborhood around it that previously felt very closed off to the campus. One of the things they really wanted to do is open up their doors to the campus, be part of the community, and help the community feel like they can use this hospital as their own. So what we looked at is using concepts like biophilia to bring the nature inside. And we also did a whole streetscape project that also helped promote bringing nature to a dense urban environment that has a lot of concrete and paving and help bring the outdoor in. So the concept is that families, patients, community members can come in and use this space and they feel welcome to do so. One of the other things that they wanted to do with this lobby is open it up to the community for things like farmers markets and craft fairs and community meetings. And they have a community room that they've dedicated to people who want to rent it out for their events. So this is an opportunity to bring the community in. So we thought about nature and bringing that in, and we thought about people and bringing them in. So the transparency between the inside and the outside with the glass was really a way to open up and lighten up the space. Again, we're trying to really emphasize on that community and the well-being aspect of it and the well rating system. Also nourishment, again, knowing that they have a really big desire to bring healthy food to the community through farmers markets, biophilia, bringing the nature inside, and then the daylight to get that into the space that very historically was a very dark space. I wish I had a before picture. Another example of a project that I wanted to share is Meridian Health, a new emergency department in a more rural area of New Jersey by the Jersey Shore. In this project, they really wanted, they were in kind of the woodsy area right before you get to the beach, and they really wanted to bring the outdoors in. In an emergency department, it is one of the most stressful times of a patient's life. They don't want to be there. They're there with unexpectedly. And how do we bring a sense of calm and a sense of kind of nature to help them realize they are safe and they are welcome and not as overwhelmed as they are going to be no matter what, but how do we help calm those fears? So this campus, the design theme was really about bringing the rural setting in, bringing the trees and nature in with the light wood tones and subtle greens and things like that to experience nature. Another example we have is Geisinger Health System. We did a new cancer center for them. This is up in Wilkes-Barre, Pennsylvania in the Pocono area. And this area is very wooded also, but also has a long history with coal mining. And so bringing both wood tones and kind of stone geometric shapes into the design approach was a way that our team felt they could connect with the community, connect with nature, and interact in a way that would help a patient feel like a sense of knowability, that they're in this space that is local to them and native to them, and a sense of calm. Again, a cancer center is not a place anywhere anyone wants to be. And if they find themselves there, how do we help them have the best experience possible? We also wanted to make this an iconic building on their campus to help bring people in and feel that this is something that's high tech and high touch, as much as you know, you want that nature feeling too. You also want to feel like you're getting state-of-the-art care and in a new, strong looking building that has still subtle tones back to nature with striations, you know, based in the trees and bringing the nature in as much as possible. And curved nature, so no hard lines or anything like that, but still a very high-tech feel. Another example is the Montefiore Medical Center up in Hudson Yards, New York. So this is an urban, small streetscape clinic in New York City and in Manhattan. And so how do you bring nature into a space that is going to be very tight and challenged, and again, a lot of concrete? So one of the things we did is brought in this wood element that's a two-story element going from your entry lobby when you come into the space to then the second floor arrival up to the clinic. You have to think somewhat vertically in Manhattan a little bit more than other spaces. And how do we bring things like light and nature into a space that otherwise might seem very harsh? Another example here is Good Shepherd Rehabilitation Hospital. This is up in more like a Quakertown area of Pennsylvania, but this is a brand new greenfield building where we were really focusing on physical rehabilitation. So this is an area where we're going to encourage movement, we're going to encourage activity, but we want to have that access to nature and that continuation of the healing process, knowing that research has shown that access to daylight and nature increases rehab times. So we want to make sure we're giving patients access to that sort of healing environment. So we have the open windows to look at the hills and mountains beyond, and then we also have imagery of mountains within the room to try to encourage access to nature. On the outside, again, trying to bring the outside in, a very large glass element in the lobby area to open up to the nature surrounding the space. But then when you come inside the lobby, there's a softer lighting element that gives you a more organic feel, helps promote the movement within that we're trying to emphasize, that when patient goes from the lobby, a nice two-story open, airy, light-filled space, to then the rehab gym on the lower right, where you're going to be doing your activity and getting better. You still have lots of windows, and we're encouraging the movement. When we don't have windows in a space, trying to try to mimic nature and bring in photography that helps inspire views and thoughts of nature as a way to also help with wayfinding. So different floors had different imagery and color schemes to help promote the wayfinding within the building. Another example of a smaller kind of boutique project from Mainline Health in Bryn Mawr, Pennsylvania, was an integrative medicine suite that really tried to deal with holistic healing. One of the key drivers of this space was healthy materials. Like I mentioned earlier, the client was very focused on making sure that we took a hospital system like Mainline Health, which has very specific material standards, and kind of greenifying them, making sure that we are picking the healthiest version of that material possible and bringing that into the space. The space ran the gamut of holistic health, movement in a therapy gym and a rehab gym, as well as massage therapy. There was a light therapy room, and making sure that the whole patient was looked after in a warm and comfortable setting, and also a sense of community within the neighborhood. And in the environment, this is a first floor office, and you can kind of see some windows outside the gym that really help bring the community in. There's a larger space for gathering as well. Another example now, when thinking about children in Nemours Pediatric Center, this clinic really helped bring specialty care to the community. And this is a shopping center that was retrofit to put this space in. And when we work with children, we sometimes have a lot more opportunity to play with color and light in a way that you might not feel you have that freedom to do with an adult environment. Working on the gym space, this is rehab therapy for children with physical issues, but there's also a mental component and behavioral health component to this, where we're trying to make sure the entire child can get the services they need in one spot, and they don't need to travel for different things like their general practitioner, any specialty needs they have. Then just as well as serving the pediatric patient is the geriatric patient in the more senior population. Nemours also has a senior care facility where they help seniors get the treatment they need for their eyes, their ears, their general practitioner, their dentistry. And so we designed a specialty clinic for senior care as well, and get their holistic care in one spot. And thinking about how we design for people who may have more mobility issues, more vision issues, sensory issues as they age, and give them guidance with visual cues, with the colors that we use, and try to bring vibrancy to that space. Back to another pediatric example. This is an adolescent in behavioral health center, and inpatient and outpatient. And this is in a very old existing building in Philadelphia that needed a lot of work to help bring it to new life and to bring the joy that they want to encourage the children who use this space to have. When you're in this facility, you're definitely going through crisis. And when there was an earlier conversation about trauma-informed design, we're trying to help bring play and light and calm in certain areas. Now, this is a more active visual on the screen, but then there's other areas where they need to be thinking about how to be calm and use things like circadian lighting and natural light and views, and but still making sure they're safe while they're receiving the care here. Behavioral health requires another layer of work on top of just bringing in beautiful light and imagery. Another example is the St. Luke's University Health Network. This is a women's and babies facility. And so when women are coming to this place for care, we want to make it their premier choice that they want to have their baby in this facility, as very close to nature, and wanting to bring the imagery inside that can help bring that sense of calm to another frantic time in your life when you're giving birth. But when you are giving birth, there's also a chance that your child may need a neonatal intensive care unit. And the image on the lower right is one of those units where we put in circadian lighting to help the babies heal faster. There's research showing that if you can get an infant on a schedule and on a rhythm, sooner they are going to heal faster. So we worked with the physicians to design the space to help their healing time. And we also looked at all the materials in the space very closely, and the indoor air quality, which is very important in hospitals, to make sure they're providing the healthiest air possible and the healthiest materials possible. Another cancer center example, this one is in Camden, New Jersey, another very urban area, and it was very important for this client to bring nature to this site. We have the open plaza here you see on the front, but then we also have a roof garden that you can kind of get a hint of on the top of that canopy roof. We wanted both the staff, the patients, and the neighborhood to feel like they had a central hub that they could come to when they wanted to access nature and have community. We brought some of that nature inside with sculptural elements like the tree of life image that you see behind the stairway, and that changes color with the seasons or with whatever month they might be celebrating. And this is an opportunity for them to use art in their healing environment. And they had a whole local art program that they brought in local artists to bring in their art throughout the building. We also worked on movement, again, using a stair when possible to be able to move within the space and not rely on elevators, and have a healthier outcome. Another shopping center that we converted to a cancer center for Virtua Health. This building, again, when we think about health, we also think about the way we can use buildings and reuse buildings so they are easier to use. And so we're not demolishing an entire shopping center, we're giving it new life, and we're reusing it in a more sustainable way. This building also needed more daylight throughout the building. When you think of an old grocery store, there's no windows. So we had to do a lot of insertion of skylights in the upper right, new windows in the back and side walls, and really think about where our window needing spaces were located. And lastly, an unbuilt project in Florida, where this is where we really wanted to talk with our clients about resilience and about building for the environment in which they're in. Tampa being a very harsh environment, and even after this proposal was done having issues with hurricane and flooding, and thinking about how we lift most of the functions off of the lower level and bring everything up a floor so you have resilience in something like flooding. And then knowing that there's harsh sunlight, thinking about window screening and elements that can help provide the right amount of daylight, and doing a lot of intensive daylight studies to make sure we're focusing on light in the positive way and giving them just enough and not too much. So that is a huge rundown of a lot of project examples that we had at our project at FCA.
Thank you, Denise.
Mm-hmm.
John or Angela, do you have any comments or questions?
Yeah, thank you for sharing such a wide variety of projects. I think this really helps everyone to see how you can take these concepts and apply them in a lot of very diverse ways. So I was hoping you'd talk a little bit more about how you decide the right choices for a population.
Yeah, that's a great question. And I think it's a very intentional conversation we have to have with our clients at the beginning of a project to figure out what their goals and who their goal populations are, and how we tailor each design around that particular need or goal for the project. And so, like in Newark Beth Israel, it was very important to bring the community in. And so we wanted to make that space feel as open and inviting to the community as possible, and not have there be any barriers to their access. So that's an example of one where we really, that was the entire goal of that lobby design.
Hey, so go ahead.
No, I'll share the same sentiment. It's really amazing to see the breadth of work and the way that the thoughtfulness with the way you approach each audience, and how well you understand who is being served in each place, and the needs of that specific user, especially the ones that don't have the ability to articulate their own needs, right? It's really incredible. You lean on research, and that's really great to see that evidence-based design really come in. I'm curious how often, and maybe it's a question for both of you, how often you as designers lean on the various rating systems, how often your clients request that you do lean on those systems, and how often you might push back against them in certain circumstances. Well living standard, well building standards, LEED, living building, all of those things.
Yeah, I'll say right now our clients are asking for it less, but we're not doing it any less, right? We might not go for an actual certification, but we use the research that those systems have helped provide. We use the rating systems as a kind of guideline or a tool along the way, so that when we see an opportunity to bring that into the project, we're doing it no matter what, whether we're saying it's LEED or WELL or the AIA, design excellence rating system. There's so many different things out there that we want to make sure that we're incorporating as best practices to really focus on impacting, the project in the most positive way.
And it's similar at our firm. Like, we actually developed what we called a resiliency org chart. So it has all of these different systems at the top, but then it also has our Salutogenesis toolkit and health equity framework and other resources and websites that you can go to understand specific things related to the area you're working in. Some of them are federal government resources. And we try to take all that and then work on it. But unfortunately, our clients don't really care about these certifications. So they're not asking us to design to these standards. We have to show the value to them of having these features in the project.
Okay, thank you so much. We've seen a lot of really interesting, solid work in this lecture and in the previous one. And we invite you to listen to John Dwyer's lecture in the next recording. Thank you. Thank you, Denise.